Medicine shortages are relatively common and can be caused by a range of different things, such as increased demand for the medicine, manufacturing issues, or scarcity of ingredients. Medicine shortages are frequently global. Often there are other brands readily available, but sometimes medicine shortages cause significant difficulties for consumers and health professionals. While the TGA can't stop them from happening, there are actions we take to lessen the impact on the community. The steps we take to manage a shortage may include providing up-to-date information on our publicly available medicine shortage reports database, sending out alert emails and social media posts, bringing together pharmaceutical companies, wholesalers, pharmacy groups, healthcare professionals and patient groups to discuss how to manage the shortage, making alternative or substitute medicines available, approving an overseas registered product, giving approval for pharmacists to substitute specific medicines without prior approval from the prescriber to ensure treatment is not interrupted. We've talked about what the TGA can do to help manage a medicine shortage. What we can't do is tell manufacturers to make or provide more products to Australia. We also can't tell them to apply for a substitute product to be put on the pharmaceutical benefit scheme. If you are concerned about a medicine being in shortage, please talk to your GP or pharmacist. To learn more or receive medicine shortage alerts and updates, visit tga.gov.au.